The objective of this lesson is to understand the indirect retainer, what it is, when it is used. This slide gives the definition. In the tooth tissue supported RPD, the extension base is retained by a clasp on only one end. Sticky foods, gravity, action of the tongue can cause lifting of the extension base away from the soft tissue. The purpose of the indirect retainer is to prevent or limit this rotational movement. It is an example of a first-class lever, which serves a useful purpose. The animation is intended to illustrate this.
In the animation, sticky food lifts the tissue-supported extension base away from the ridge. This lifting may be limited with the use of the indirect retainer placed anterior to the fulcrum line.
The indirect retainer is employed in all Kennedy Class 1 and 2 designs, or wherever there is a fulcrum line. Generally, tooth-supported RPD Kennedy 3 and 4 do not have a fulcrum line, thus do not require indirect retainers. There may be exceptions to this rule, if the edentulous space is extensive.
To identify the need for indirect retention, first identify the fulcrum line. All Kennedy Class 1 and 2 RPD have a fulcrum line. The fulcrum line in the distal extension base RPD is a rotational axis, which passes through the two most posterior rests on opposite sides of the arch.
The indirect retainer is normally located on the side opposite that of the distal extension base. The effectiveness of the indirect retainer is contingent on several factors, such as the characteristics of the Class 1 lever system present, and rigidity of the components. Rest seat forms which bind the partial denture in function should be avoided to prevent tooth trauma. Placing the indirect retainer anterior to the fulcrum line as far as practical increases the length of the resistance arm, thus increasing the efficiency of the indirect retainer. Once the concept of indirect retention is understood, the concept may also be applied to extensive anterior extension base partial denture designs.
The efficiency of the indirect retainer is increased the further anterior it is placed. In addition to preventing rotation, the indirect retainer can provide some vertical support in conjunction with the primary rests on opposite sides of the arch. The indirect retainer provides a third point of reference to orient the RPD. This is very important when determining the need for a reline, or evaluating the effectiveness of the reline procedure. A table of indirect retainer characteristics is shown in the slide.
The indirect retainer is located ideally as far away from the fulcrum as possible, and perpendicular to the fulcrum line.
Indirect retention can consist of basically any component anterior to the fulcrum resting above the height of contour. Usually well-formed rest seats are best. Linguoplate major connectors should be rested on both ends to provide indirect retention.